you everybody for coming. If you're getting here a little late, you missed some of our festivities earlier in the morning. You should know that today marks 69 days before the election, so happy 69 Day. And if you're with the media and haven't gotten a press packet, there are piles of them right there on the bench. But I'm Owen Perkins. I'm the Director of Communications for ColoradoCare Yes campaign. And I wanted to share, I saw a great article, I think it came out this morning in the Eugene, Washington newspaper about ColoradoCare and talking about how good this will be for Colorado and for the country. And they pitted us, as is not unusual, as somewhat of a David and Goliath battle, with the obvious Goliath of the corporate insurance industry and the millions of dollars that they're pumping in to oppose this race. But the writer of this op-ed said his money was on David, and he was betting on David. So glad to be here with David and to make those bets come home. But today we really want to focus on the financial part, and we've had several financial analyses of ColoradoCare. Dr. Jared Friedman from University of Massachusetts did the first one, I believe, and recently the Colorado Health Institute put out a comprehensive and fairly solid report, and subsequent to that we've seen some analysis from Dr. Anders Fremstad up at University of Colorado State University, and Dr. Jeff Helton at Metro State University. You'll get a press packet immediately, additional materials by email immediately following the press conference, and you'll have some materials from them. Those two last economists, neither of them could be here today. But one of the things that all of the analyses show is that ColoradoCare can achieve its goals of covering all the uninsured in Colorado, the hundreds of thousands of uninsured, the underinsured, and bring them all in while saving money and cutting costs in health care. There's some discrepancies on some of the fine-tuning, and we're going to get into those details today. And I want to start off, we've got three speakers. I want to start off with somebody who was a leader on healthcare issues during her term in the Senate, representing Senate District 16. I think she represented at least 7 counties in Colorado, the best of which being her home county of Gilpin County, where she remains a leader as a former public nurse and a leader now with Nurses for ColoradoCare. Let me introduce to you Senator Jeanne Nicholson.
ColoradoCare, Amendment 69, will operate in the black. The Colorado Health Institute's report was very thorough and very thoughtful. There were many features of the report that I appreciated. I appreciated how many variables they considered. As we all understand, healthcare involves many variables. The healthcare report also acknowledged that they were making several assumptions and talked about best case and worst case scenarios. That made the report an outstanding report in many, many ways. However, I strongly disagree with Colorado Health Institute's conclusion. There is no evidence that suggests that ColoradoCare will not be financially sustainable. There is no evidence that suggests that the hospital provider fee funds that we will rely on as a portion of our funding will not be available to us. There is actually very strong evidence, in fact, precedents from the federal government that suggests that many, many waivers and demonstration projects have been approved by the federal government that tell us that the federal government encourages state innovation. I don't think there's any other big example of state innovation that can compare with ColoradoCare Amendment 69. And that is precisely why we are confident that we will have the funds that we need in order to provide access to excellent health care for every Coloradan, and at the same time save tremendous amounts of money in the first year and on ongoing years. We are sure that the money will be there. In fact, when you compare what we will save over time with compared to our current for-profit industry system, it's remarkable how much better we can be in terms of our health, as well as financially how much stronger we can be because we are not wasting money on unnecessary administrative costs. I want to particularly acknowledge Ralph Ogden, our legal counsel, for all of his input in helping us to understand all of the federal waivers, demonstration projects, and regulations that will allow us to say with great confidence that those hospital provider fees will be available to us, as well as all of the other funding that we are assured from the federal government and the money that we will collect here in the state. Just a reminder, the way we will pay for this in part will be the $25 billion tax increase that will come from employers paying 6 2/3% of payroll and their employees paying 3 1/3% of their incomes. I want to make it very clear that that $25 billion tax increase is a cost savings. Usually when we talk about tax increases, we're not talking about cost savings. We're talking about building a new school or a new park, new recreation center. But this is the rare occasion when that tax increase is a huge cost savings, because we are replacing the way we pay for health care now with the way we will pay for health care under ColoradoCare. We will replace those costly health insurance premiums with this much more modest cost for our citizens. Thank you.
Senator Nicholson, and in case you didn't say it, that $25 billion replaces the $30 billion that we now spend in Colorado for health care. That's what families and firms pay for health care. So there are realities of costs that anybody providing health care is going to have to face, and ColoradoCare will face that. The current corporate insurance industry model faces that also. We know there have been rising costs. We know that the corporate insurance industry model has been to meet those rising costs by constantly raising the premiums and the deductibles. ColoradoCare has the unique function compared to current insurance models that it has a set 3.33% for employees that doesn't change without a vote of Colorado residents. So that's something that is a major difference between what we'll see from ColoradoCare and what we currently see. You won't see those escalating insurance premiums every year. We've got a fixed rate, and we're going to get into right now some of the nitty-gritty that shows how we're going to keep that steady for the next 10 years. And so I will introduce the Executive Director of ColoradoCare from Boulder, Dr. Ivan Miller.
Thank you very much. It's a pleasure to be able to get this information out. The important information or announcements that we have for today is that the Colorado Health Institute analysis, although, as Senator Nicholson said, it was excellent in many ways, it was incomplete in three essential ways. First of all, it overlooked essential funding from the state of Colorado that the amendment requires the state of Colorado to provide. Second, it ignores the ability of ColoradoCare to contain the growth healthcare costs. And third, it ignores available federal funding. With these corrections, we'll show that ColoradoCare would have in its first year of operation a surplus of $2.6 billion and would operate in the black for 9 years. Let me give you a little background first. When the CHI analysis was published, we were concerned about the figures, and our campaign has had a number of professional communications with the CHI economists, asking them, how they came up with their results, and they explained that to us. With that additional information, we were able to see where they made a mistake. So another piece of background information is this amendment has been carefully thought out for 8 years and was proposed as legislation 3 times. When something is legislation, the legislators get the assistance of the attorneys in the Legislative Counsel Office. These are the attorneys that help legislators write legislations, and they have to be experts in Colorado constitutional law and statutes and know where there's overlaps and problems. We asked them, how do we ensure that the state of Colorado will continue to fund health care at the same level after the amendment passes as before? And then we put the necessary language in the amendment. In talking to the CHI economists, we learned their process for coming up with the numbers. And what we understand they did is they assumed, because if you read the hospital provider fee statute, the money would not be available for ColoradoCare. It just would not work. So they said, or hypothesized, that it'll be repealed. Then they said, well, the state won't have enough money for federal matching funds, and so that'll eliminate the Children's Health Program Plus and the Medicaid expansion funds from the federal government. Overall, a $2.3 billion subtraction of revenue that the amendment requires. So what their assumptions, every step of that process is prohibited actually by the amendment. I'll read here that Section 8.2 of the amendment says that the state shall transfer to ColoradoCare all state and federal funds for the Medicaid Children's Basic Health Plan, that's CHIP Plus, and any other program to be administered by ColoradoCare. The amendment says you cannot throw away these programs. You have to transfer the money to ColoradoCare. Section 12(1)G says that the General Assembly shall enact legislation to ensure that the state's expenditures for health care services, including the state's responsibility for providing matching funds for Medicaid and other federally supported health care programs, do not fall below the expenditure level for health care services in the year preceding the effective date of this article. And in your press packet, there's a handout that has this language highlighted in yellow, just like I have here. This says that the state funding can't be removed. It must stay there. Their third assumption is that because the state funding is gone, the federal match would be gone. Well, since we've established that state funds will be there, the federal match won't go away. And the fourth point here is at the core of this issue that we have, to simplify, there's a statute and an amendment that conflict. Well, this happens with every constitutional amendment. once an amendment is made, statutes have to be changed. This is the way things are done. The language in the amendment addresses this in section 12.1H. It says, the General Assembly shall enact legislation necessary to implement this article. So what that means for the hospital provider fee is it needs to be rewritten, because that's the only way to maintain funding. It's not a complicated rewriting. All that has to be done is you add a section that says money can be collected to support required ColoradoCare funding. The statute has already been rewritten twice to add programs. There's no reason it can't be rewritten again. So, with these changes, that's actually a $2.3 billion addition. And the CHI analysis predicted a $253 million deficit. Already, with just bringing it in compliance with amendment language would create a $2 billion surplus. Another important aspect of the economics of ColoradoCare that was not brought up in the CHI analysis is what we call the guarantee clause. That before ColoradoCare can go into effect, it has to, in order to get the federal waivers, there has to be a new actuarial analysis. And this new analysis has to show that ColoradoCare is fiscally sustainable. The amendment actually says in section 16 that if this analysis or any other reason shows that ColoradoCare is not fiscally sustainable, the board shall shut the program down and return the taxpayer money before it is fully implemented. So this is the guarantee to the people of Colorado that ColoradoCare will be fiscally sustainable and run in the black. The second way that the analysis overlooks funding is that, this is expenses. The second incomplete part of the analysis is looking at future growth. CHI in their analysis projected future growth as if ColoradoCare was no more able to control costs than our current fragmented insurance industry system. Even opponents of ColoradoCare, even opponents of universal health care have written economic articles saying that a program like this can contain the growth of healthcare costs at least 0.5% per year. So that's the Urban Institute, Kenneth Thorpe, who critiqued some of the single-payer proposals. So using their figures, we put in 0.5% per year change in the rate of health care cost growth. And the third place where the analysis was incomplete is that it assumed that waiver funding would be cut. I think Senator Nicholson explained very well that the federal government's encouraging waivers. States are not going to apply for waivers if there's a funding penalty put in by the federal government. It's, I think, highly likely that we'll get all the waiver funding, and that adds another $660 million. So you take all of these changes, and you get the chart we have here. It shows in 2019, starting off with a surplus. Green line on top is revenue. The blue line is expenses according to the CHI methodology. And you can see that it takes 9 years before the expenses grow to be as much as the revenue. So ColoradoCare will run in the black into the future. So to summarize here, there's 3 big points. One, the amendment language requires funding that was not in the CHI analysis. Number 2, the CHI analysis did not look at the widely recognized ability of a single system to contain the growth of healthcare costs. And number three, the federal funding is highly likely for an additional $660 million. That's how we came to our figures. Thank you.
Thank you very much, Dr. Miller. And that's his last point, I think, was one of my favorites, that there is this incredible standard that we have to meet that's very challenging and should be very comforting. There's three parts to it. We've got to ensure as many people or more as the Affordable Care Act ensures and able to, in order to get the waiver. In order to get the waiver, we need to have the same benefits or more as are available under the Affordable Care Act. And in order to get the waiver, we need to spend cost as little or more. And those are critical. We can't move forward without meeting all those standards. And that should be a great comfort to Coloradans that know we can't go recklessly forward. We will only be moving forward. We can only be moving forward if we meet those very challenging and carefully scrutinized standards. Our faith in the language of the amendment is the reason that we're here in the shadow of the Supreme Court. And, we believe the language matters, the words matter, the amendment and the Constitution matters, and we know that we have a legislature that will back up that language. I want to now introduce one of those legislators who has been a leader and comes to us from Longmont up in Boulder County, in District 11, Representative Jonathan Singer. Thank you.
My thanks to everyone that's here today. I am Jonathan Singer. I represent Colorado's House District 11 up in Niwot, Longmont, Lyons, and Allens Park. And far be it from me to accuse anyone else of getting into the weeds, considering what legislation I'm most probably well known for. But that's part of the reason that I'm here today. In 2012, we had another ballot initiative, Amendment 64, come to the people of Colorado. People of Colorado overwhelmingly voted for this. We got more votes on Amendment 64 to legalize and regulate marijuana than we did to get Barack Obama the presidency. At the same time, only 2 legislators supported that same issue. 2 out of 100. 2% of the legislature, over 55% of the state. At the end of the day, my job as a legislator is to make the will of the people work. Amendment 69 creates a prescription to make the will of the people work by making sure that it reaches certain goals, but then puts the power in the hands of the legislature and a publicly elected board to make sure that we move forward in a way that's responsible, in a way that saves money for the state of Colorado, saves money for taxpayers, and also saves the lives of Coloradans. With the rollout of Obamacare, we still have too many people left behind. And that's why we have this federal waiver process. That's why we are moving forward with Amendment 69, because this waiver process will make sure that those 300,000, over 300,000 Coloradans who have no health care today have a fighting chance at life. It's that simple. And then there's this chart, which is a little more complicated. But this is what we need to do. We need to make sure that we have a way to make sure that those 350,000 Coloradans, a number 4 or 5 times the number of people you could fill up in Mile High Stadium on any given day, have a fighting chance at life. Apart from that, I come from a city in Longmont. In most cities, we have balanced budgets, just like the state of Colorado. In a balanced budget situation, we're looking to save costs every single day. What does that mean? It means that if we pass Amendment 69, we're projected to save in our city $4 million into city coffers. When we're dealing with transportation issues, trying to get fast tracks up in my neck of the woods, making sure that affordable housing and homelessness are effectively addressed. When these issues come to light, and we can save $4 million in healthcare and cover more people, why not do it? And to the naysayers out there that are saying, let's wait for a federal response. Well, we didn't wait for a federal response when we legalized marijuana. And you know what? The sky hasn't fallen. In fact, we've created a $1 billion industry, and we've seen our economy jump and grow and expand beyond anyone's expectations. That's exactly what you can see with Amendment 69. If we wait for Congress, Politico just dubbed this 2016 Congress the Seinfeld Congress. It's a Congress about nothing, because that's what they pretty much got done. So if we're waiting for Congress, we're not going to see a change. And when we have 300,000 lives on the line in the state of Colorado, let's set the pace for the rest of the nation. Let's set an example. Let's show that we can be that laboratory that our nation can follow. This is exactly how healthcare rolled out in other countries. So as a lawmaker, I stuck my neck out 4 years ago, and I think we've all seen the fruit that it's borne. This year I'm willing to stick my neck out again and show that we can do things better in Colorado. We can set the standard and the example in a way that saves money and saves lives for our people, and not only that, but sets the next standard for our nation. We can move away from Obamacare and into something that's affordable for the rest of the nation. So in that, I'll just close it and say thank you very much for your time. I appreciate it. And thank you again for your attention.
Thanks. We really appreciate Representative Singer's courage on many issues, including this one. He's inspired people throughout Colorado, and he's inspired people, I think, everywhere to join this cause. If you haven't heard, this week, over the past week, we've got endorsements from the likes of Senator Bernie Sanders of Vermont, Dr. Jill Stein from the Green Party nominee for president. We have some 22, I think, Democratic county parties representing about 62% of the population of Colorado who have endorsed it. It's been the full spectrum of support coming in, and that's so important. Somebody from NBC, to follow up on Seinfeld, called a couple days ago and asked, well, with Senator Sanders supporting this, it must be a no-brainer that ColoradoCare will win on the ballot in Colorado. I hope that he's right in his assessment, but we don't take anything for granted, and we are asking Coloradans to show the courage that so many have so far to fight for universal health care for all Coloradans. We encourage you to read the amendment in full and learn the details, learn the answers to so many of the challenging questions that's on our website at www.coloradocare.org. And we would like to open up now for questions of the press. I think before we take those questions, I just want to hope that you've all been able to hear adequately today, and thank Jeanne Nicholson, who set up our sound and combated the necessary work of the lawn work and things like that, the traffic of the city, to make this a successful, audible event. So now we will take questions for any of our speakers from the press, and they'll also be available afterwards. Yes. Okay, the question is, what payment rate for medical providers does this assume? And I'll turn that over to Dr. Miller.
It's not exact. It needs to be well above Medicare to cover costs. The bottom line, and proponents and opponents agree, that ColoradoCare must pay providers an amount that attracts new providers to Colorado. It's sort of like, I see it as like you have to pay the water bill if you want water. If you want providers in Colorado, you have to pay them the amount that we need a steady inflow of providers. There's no disagreement between proponents and opponents on that.
The assumption is something greater than the Medicaid reimbursement?
No, not Medicaid. I said it has to be substantially greater than Medicare, because Medicaid pays around 65 cents of the dollar, and they say that Medicare is 80 to 85 cents of the cost, and Medicare will continue. So ColoradoCare has to pay, on that scale, it would have to pay a little above 100% to balance out the money providers lose on Medicare. But it's a market. Markets are fluctuate, and the insurance companies have not released their figures for 2019 either. Yes?
I have a question about the second part of all this, the cost containment. As you know, your opponents will say the only way to contain costs is to ration care. One thing we see with Obamacare is that just getting more people insured does not contain costs. How do you address that you can contain costs without rationing care or...
Let me just repeat the question. She's asking how do we contain costs without rationing care? How do we deal with that cost containment segment of it? I know Dr. Miller got into that a little bit with some of what's inherently active in containing costs through a Medicare for All type program like this, but I'll let him elaborate some more.
Yeah, it was interesting. We talked with the Colorado Health Op Board about this, and they said that one of the things they liked about ColoradoCare is as an insurance company, they only had two ways to contain costs. One, you mentioned they it's not rationing care, but it makes care difficult to get, like all the insurance, I mean, we all know the insurance games that get in the way. And the other way is to cut the amount you pay providers. ColoradoCare has a third way. ColoradoCare can cut overhead. It can also affect practice patterns. It can cut out duplication of services with a better database. It can stop price gouging. Health One, who's actually funding the opposition quite a bit, had a 32% profit this year. 32%, while their hospitals were only 65% full. I don't think 32% of our healthcare dollar should go to profit. I mean, and that's after all the money it takes to build all the new hospitals. As Dr. Friedman points out, except for pharmaceuticals, healthcare is really local. Practice patterns, there's robust literature that says if there's more primary care, then there's less expense and and better outcomes. So it just would have to encourage primary care. That's not taking something away, that's adding something. So there's a lot of ways, and I can go on and on with fraud. There's and the economists that have papers have listed a number of ways.
So with CHI's analysis, right? I mean, the way you're making certain assumptions, they're making other assumptions, but big picture, we're dealing with a lot of unknowns, right? I mean, and that's what makes it so hard to know how this would play out, right? You're assuming it'll go, you'll get full waiver funding, you'll be able to bend the cost curve down. They're not so sure, and that makes a big difference with the 10-year projection, right? So we're sort of going into uncharted territory, which makes it such a challenge.
Well, I don't think we feel it's so challenging. It's not really uncharted territory. Every other industrialized country in the world has some sort of program like this to ensure universal health care for all their citizens. And we're very closely modeled on, the best model is probably Medicare, which is the most effective and most popular government program year after year, and is incredibly efficient and streamlines the bureaucracy and lowers costs. So we have projections based on precedent, and a big part of the difference in our two visions and economic analyses is depending on the federal funding that has always been there when Medicaid waivers have been granted, when federal funding waivers have been granted. They set up this clause in the Affordable Care Act with the intention of encouraging people to find innovative ways to improve on health care, and we don't think they're going to penalize people for doing that. So it's a pretty safe projection based on precedent that this funding will be there, countering some of the unprecedented assumptions that it will disappear on the other side. So we're pretty confident on that side.
Let me just weigh in with a couple more things there. Before it was introduced as legislation, Dr. William Schau from a Harvard economist looked at it. He's got a son and granddaughter in Senator Aguilar's district. And he's probably the leading healthcare economist in the world, and has designed systems for 24 countries. A lot of those have been implemented. So he does projections, designs them, and gets them implemented. And he didn't do the financial analysis. He said, this looks like a good program, go for it. Our projections are in line with the analyses he's done other places. And also, there was another analysis done of a single-payer system in Colorado, an objective one done under Governor Ritter at the 208 Commission. It analyzed a lot of systems, and one of them was a single-payer system, and the results of Governor Ritter's objective analysis was almost the same as ours.
Well, I was just going to say the Medicare actuarials projected the current system is going to increase at about 5 to 6% over the next 5 to 6 years, and that was just published about 3 or 4 weeks ago. And every year they project these costs. Now, that graph behind you would be more helpful if it showed the current system is going to be about $4 billion higher in 2019, and it's going to increase more than what ColoradoCare is going to increase. So if you just added that extra line in there and put a little bar, you would see the gap is going to increase substantially over the next 10 years.
Thanks. If you couldn't hear his point, he was making the point that the costs are projected to increase at a little bit above 5% a year, and if somebody has a magic marker and we can draw in the current system, you'd see it's roughly $4 billion by the end of 10 years, I think, higher than where ColoradoCare would be. As I think I've mentioned, and we probably covered, they have a solution for that, which is to once again raise your premiums and add deductibles. So there are ways that they can keep protecting the profits for the corporate insurance industry. Don't fear. Any other questions? And we'll take a couple more if there are, and otherwise all the speakers are available for one-on-ones if anybody would like. Any other questions from the press? All right, well, thanks again for coming. Happy 69 Day, and we'll see you at the polls. Take care.
Oh, okay. Okay, yeah.